Hello students, the next topic that we're going to learn is congestive heart failure. Now, congestive heart failure is one of the most important complications of heart disease. So, in the complications of heart disease, the most important one could be heart failure, means the heart is not able to pump adequate amount of blood so that the body is not able to receive them and the body needs are not able to be met or accomplished or fulfilled. So, means what the heart pumping activity or pumping ability is affected. Eventually the ventricles are not able to pump so that the circulation is not reaching the rest of the body. The other complications will also include a heart attack, stroke, aneurysms, peripheral artery disease, and eventually leading to sudden cardiac death as well. Now, according to the New York Heart Association, the heart failure classifications will include into 4 sections. Means in the first type of classification of type 1, means there is cardiac disease but no symptoms and no limitations in the physical activity. So maybe it is not very prominent, the patient is still able to carry on its activities even though the symptoms are not being very obvious or very significant. In the type 2, again, the symptoms can be very, very mild. Okay, so maybe some of his activities are limited and he's not able to perform his physical activities as much as he wanted to. So the symptoms may appear very mild like. The type 3 again means significant limitation in the activity, means even just by stepping up a flight of stairs or going for a walk or going for a jog or a run, this can put the patient in a lot of breathing difficulty situation, means the patient will be out of breath and again it's going to put him into a condition where he is going to be feeling excessively tired and fatigued. And in type 4 classification means there are severe limitations, means what happens, the symptoms are very, very prominent and significant, and even while the patient is resting, the symptoms can be very obvious. Now, what is congestive heart failure? So, nothing but a progressive condition that affects the pumping power of the heart muscles. So, it is as simple as that. So, mainly congestive heart failure means what? The ventricles are failing to pump effectively. It is also referred to simply as heart failure, and it refers to a stage. What happens because of heart failure? Again, it can be either on the right side of the heart or the left side of the heart. So again, if the left side of the heart, that is going to put a lot of pressure on the pulmonary system, again putting the fluid back in the lungs. And on the right side of the heart, if there is a failure, again that's going to cause a lot of edematous condition or a situation and affecting all the body organs as well. Now, congestive heart failure, this picture here, I'm sure you can appreciate the normal heart, and a heart failure means what? You can see that the left ventricle, how different it looks from the right. Again, it is quite dilated, and again it looks very weak and very sluggish, and it is not in a position to actually pump effectively. And when you look at the heart structure, so this is what it is. So that definitely there's going to be reduced volume that is coming out of the aorta. So this is also because of a dilated ventricle, means as an enlarged ventricle. Now, in this picture here, it's very obvious in the top picture that you can see an enlarged heart, means the heart is supposed to look like this, which says a normal heart, but in an enlarged heart, this is what it looks like. And again, how the dilated ventricle can affect the heart pumping action. So it can also be the pumping actions, again, or the congestive heart failure, in a diastolic failure and a systolic failure. I'll tell you that in detail in this slide. So heart failure, as I mentioned, it can involve both the left side as well as the right side of the heart. And left ventricle, when we say left side of the heart, means the left ventricle is affected, and the right side of the heart means the right ventricle is affected. Or it can be in such a way that both ventricles have failed. So that's going to be a very, very emergency or a life-threatening condition for the patient. Now, when the left-sided heart is being affected, or rather there is failure, means what? This is going to put a lot of pressure on the pulmonary system. So there's going to be fluid in the lungs, and that is when you can see that the patient is going to be feeling very, very difficult in breathing, and there's going to be severe shortness of breath. So oxygen is the priority. And in the right-sided heart failure, the fluid may back up in the abdomen, lungs, and also in the feet, and it can end up as a very serious or severe edematous condition. So there's going to be obvious swelling on the feet as well as the extremities and also the abdominal organs. There is also something called a systolic heart failure, means what happens, this is going to be indicating the pumping problem. Okay, so the pumping activity or ability of the heart is being affected, so the ventricle cannot contract as it is supposed to be contracting. And diastolic heart failure means, again, the ventricles are not in a position to relax. So we know that when I was talking to you about The heart block also, I had showed you about the ECG and telling that it starts off with atrial depolarization, then ventricular depolarization, and then the phase is the ventricular repolarization, where there is a resting phase, so that which is also very important. So means again when you say diastolic, again it is indicating something with the filling problem of the ventricle. Now, what are the main causes for this particular condition? It could be anywhere because of coronary artery disease or any sort of heart problems, high blood pressure. It can also be because of faulty valves. So again, any kind of valvular heart disease can also be a problem. It could also be cardiomyopathy, means again it's because of the heart muscles are damaged, and again it can be due to various factors like sort of any other kind of muscular conditions or muscular disorders, some kind of infections, due to the patient's lifestyle. It could be excessive alcohol use, the toxic effect of certain drugs, and it can also be because of some sort of genetic factors as well. Also may be due to infections and inflammations of the heart involving myocarditis and endocarditis as well, and it can also be a congenital heart defect problem as well. So this can also lead to this particular condition. This condition can also be aggravated when the patient is having arrhythmias, means the heart rhythm problems, okay? And other diseases like chronic diseases, which includes hypothyroidism, and also it can also be excess of iron in the thing, so hemochromatosis, and also it may contribute to this kind of heart failure condition. Now, what are the clinical signs and manifestations or symptoms in this particular condition? So obviously, due to this failure, again, the patient is going to be having severe breathing difficulty. There's going to be shortness of breath or dyspnea, fatigue, weakness, swelling or edema in the legs, ankles, and feet. Also, there's going to be irregular heartbeat. The patient's physical activity is also going to be reduced, so the patient's ability to exercise also is going to be reduced. There's going to be always a persistent cough and wheezing. Okay, and again when we say heart failure, again it's also associated with the cardiac output. So obviously there's going to be decreased cardiac output, and it can also be because of a swelling. The patient can also come up as swelling in the abdomen and the organs. Also leads to rapid weight gain. Okay, so means the patient's weight can also be increased, and this is nothing but because of the fluid buildup. Definitely the patient is going to be experiencing low nutritional status, obviously not able to eat, or there's no appetite and feeling nauseous. Difficulty in concentrating, again it's nothing but to do with the circulation, because as you know there is failure, again the body parts are not able to receive the adequate amount of blood and oxygen. Also the patient is going to be experiencing severe chest pain. Now, this is what I was explaining to you when I explained about the congestive heart failure, how it's going to be affecting, especially when you have a right-sided heart failure and the left-sided heart failure. So the right-sided heart or the left-sided heart failure, you can see how it's going to put a lot of pressure on the pulmonary system, and you can see that there is fluid buildup in the lungs, and this is going to cause excessive breathing problem or severe breathlessness. And the right side, again, this is what the alveoli looks like. So you can see that the air sacs again with fluid. Okay, so that is what is causing the breathlessness problem. And the right side of heart failure is going to show this kind of severe edematous situation, and you can see how swollen the patient's legs are. So this is just the main signs and symptoms of the left-sided and right-sided heart failure. The 4 stages of heart failure, again, I just explained to you in the beginning according to the New York Heart Association. So in this, they just explained to you a little more, saying stage 1, what happens, stage 2, stage 3, and stage 4. So stage 1, it usually begins off with a slight breathlessness, some kind of a difficulty in breathing, especially when the patient is doing small walks and he starts to notice this. Then in the second one, again, usually when the patient is resting, they're fine, they're comfortable, but again, any sort of, excessive activity can put a lot of stress or pressure on the heart and can cause this breathlessness problem. Stage 3, what happens is, again, it could be patient is experiencing some kind of heart rhythm abnormalities, palpitations, and even the simple tasks like getting up from the chair or from the sofa and just walking ahead, again, can be a lot of problem, because that itself can cause a lot of breathing problems or difficulty. And stage 4 means what? The heart and the breath can go faster even at rest. So that is the most important thing. So even while resting, the patient can experience the symptoms, and breathing difficulty becomes really, really severe. Excessive tiredness even while sitting or resting, and again there's going to be severe palpitations. The risk factors associated with this condition will include your comorbidities, which is nothing but your high blood pressure, diabetes, certain medications when the person is on long-term or chronic illnesses, It can also be due to any sort of heart diseases or heart attack, and also it can be due to the cardiovascular diseases or disorders, and even coronary artery disease can contribute to this particular condition. And also, as I mentioned, it could be due to congenital heart defects, valvular heart disease, any sort of infections and inflammation affecting the heart, and also involves or includes the patient's lifestyle habits like alcohol use, tobacco use, obesity, and also if the patient is having any history of arrhythmias, and if there is a weakening or the heart is not able to contract effectively. Complications associated with this particular condition will include kidney damage or failure, heart valve problems, heart rhythm problems. Now, how do we diagnose this particular condition? So obviously we start off with a thorough history collection and physical examination, followed by blood tests, chest x-ray, electrocardiogram, and echocardiogram. Stress test, again, which is going to be assessing in deep about how much the heart is able to bear or how much the heart is able to tolerate the activity. CT scan, MRI, coronary angiogram, which is another important test, again, which will help in assessing the ventricular activity or the contractility of the heart. And also it could be there's also going to be myocardial biopsy, which can also be done. Again, this is nothing but especially when when there is the tissue damage, so we just need to rule it out, so we just do a biopsy, and this is another additional test that can be done in order to rule out certain complications in the medical management for this condition will include, yes, obviously taking care of your blood pressure, so the patient is going to be on beta blockers, ACE inhibitors, and these medications will also again either slow the heart rate and also reduce the blood pressure. So all this, especially with the palpitations and arrhythmias, all this has to be kept under control, and also this will also reduce some of the abnormal heart rhythms and lessen the chance of patient ending up in severe complications. Medications will also include the diuretics, because you saw that the patient is going to be experiencing severe edema and edematous conditions, and also inotropes, again, which is going to improve the heart pumping function and maintaining blood pressure. Also digoxin, which is going to be increasing the strength of the heart muscle contractions, so which is very important, because here the body is not able to meet the daily needs or the body's needs to function effectively, and that is the reason we need this kind of medications. And very importantly, the patient has to be advised thoroughly about when and how and what is the dosage of the medications and the importance of these medications and why is he on so many medications as well. So it's important to provide the heart that support so that the patient's heart is functioning. Surgical management will include coronary bypass surgery, heart valve repair, and also sometimes what happens, the patient may also need an implantable cardioverter defibrillator. So defibrillator is something, a device similar to the pacemaker, but here what happens is it will actually deliver shocks, okay, especially when there is heart rhythm problems. Again, the patient's heart may, I've explained to you this again when I've told you about the different rhythms. So again, when the patient goes into life-threatening arrhythmias, then this device will actually deliver the shock and will set the heart back to its normal rhythm. And also what happens, this is also very important, because we do not want the patient to end up in severe complications and resulting in death of the patient. A pacemaker, again, it may control the heart rhythm, so I've shown you what the pacemaker also looks like, and an ICD monitors the heart rhythm. Again, it senses, so mainly the implantable cardioverter defibrillator is nothing but it will kind of sense the important or the dangerous rhythms, and it will actually deliver the shocks and will reset heart and also help the heart to function in a normal pace. It really shows you how the pacemaker is being inserted, because it is a small generator. It sits below the skin and it's got one lead. Again, this is another, and the cardioverter, implantable cardioverter defibrillator, is slightly bigger than the pacemaker, like the pulse generator. Again, it can have 2 leads, and again it can be 3-leaded as well, and this is what actually monitors and it senses the heart rhythms, and whenever the heart is showing having some abnormal rhythm, this will actually deliver the shock as well. So it is the defibrillator itself means like which delivers the shock. Again, another method of management will be cardiac resynchronization therapy, or CRT, or nothing but the biventricular pacing. So again, this is all associated with the pacemakers. I don't want you to learn it in detail. This is just for information's sake. So just have a read through this, and all this is going to enhance the pumping action of the heart and to help the heart pump effectively. So this is the And this is what the pacemaker does. It kind of detects, it transmits, and again it paces. So this is the important ways. As I told you, there can be 3 leads, and this is what it does. And when it makes sure, it kind of senses an abdominal rhythm, it will deliver the shock. And that means we do not want to have to shock the patient externally like how we shock on the patient's chest, but this device itself will do the. Again, ventricular assist devices, as I mentioned in the previous condition, it's going to help in the pumping action of the heart. And last but not the least, the only choice where none of these methods of management have been successful, then heart transplant is the only choice, and this is going to improve the patient's quality of life as well. And how do we, especially in this condition, we can help the patient in palliative care or end-of-life care, because again, it's some of the condition where it is life-threatening. Again, sometimes the patient may need kind of home assistance, and where there is a nurse at home to take care of the needs of the patient. And this will also give the patient's family a bit of confidence, because we know that almost the patient is like in the end stage of or quite terminally ill, and how the patient can have some assistance at home. So especially when the patient is on devices like the implantable cardioverter defibrillator, patient's family can be quite anxious about this, and all this can be taken care of by our home nurse as well. So this is not very mandatory, but again, if patients are opting for this, then there is an option where we can help the family or support the family with this kind of care. Nursing management again will include thorough history collection, physical examination, and also the nursing priorities is nothing but to improve the myocardial contractility, reduce the fluid volume overload, because this patient is going to be in edematous condition, preventing complications, improvising the breathing conditions, improvising or supporting the patient by administering oxygen, and ensuring the patient is receiving adequate medication or medical management and the therapy. And also explain to the patient and the family regarding the different methods of management, getting them prepared, talking them through with the different procedures, what is the best for the patient, getting them to sign the consent form, and when they're ready, ensure that the patient gets the procedure. And even the aftercare or the post-surgical care is very, very important, where the nurse actually explains the post-surgical needs and how it can be met to the patient. And I'm sure I have explained to you all this in my previous So then diagnosis again is a whole lot here, because again it's regarding the heart failure. So definitely decreased cardiac output, activity intolerance, excess fluid volume. Risks are associated with a particular condition, acute pain, ineffective tissue perfusion, ineffective breathing pattern, ineffective airway clearance, fatigue, anxiety, fear, and last but not the least will be impaired or deficient knowledge. So this is a nursing diagnosis and nursing management, how the nurse plans the goals. Again, it's going to be focusing on improvising the physical activities, reducing the fatigue, improvising the patient's breathing pattern, and decreasing anxiety. Prevention will include lifestyle changes, no smoking, and controlling certain conditions like your comorbidities like high blood pressure and diabetes, staying physically active, eating healthy diet or maintaining a healthy diet. Maintaining healthy weight is also very, very important, and also important is to reduce and manage stress. Okay? So this is another detailed explanation about your lifestyle and home remedies. Just have a read through, and this is what you'll be counseling and educating the patient and the family about. Coping and support mechanisms also very important, because as I told you, once it reaches a stage where there is going to be heart transplant, it's going to be very, very difficult for the family as well to take a decision, and knowing about the prognosis about the patient. So again, all this has to be handled very delicately and very sensitively by the nurse who's looking after the patient and the family. With that, we finish the topic. Thank you for your time.